Dr. Delp was born in 1902 in a sod house in northwest Kansas. He graduated from the KU School of Medicine in 1934, stayed on in internal medicine until he left with the 77th Evacuation Hospital Unit for a tour of duty in World War II.
Lieutenant Colonel, Light Colonel Mahlon Delp. Straight and rigid, and tight and taut, respected, and all the rest of the men of his age group got out of the service and went home at that time because all of we young fellows had come in. And they'd all been in combat, they'd been overseas. And I went in, I guess, in the fall of '45, as I recall, and Dr. Delp could have gone home, but if he was willing to put in 6 months further, he would get his eagle, and he did. And I must say that you and I both had known the old guy a long time. He made one hell of a colonel. He was built to be a colonel, and when God created colonels, they had Mahlon Delp in mind.
I was always surprised he came out, frankly.
I never thought he would. I think he still has that eagle in his pajamas.
Dr. Delp left the service and returned to clinical medicine. He recalls the road that originally led him there.
I was titillated a little bit by surgery because I liked Dr. Orr, and he made a good pitch towards recruiting me. a much better pitch than Dr. Major did, which bothered me a bit, but I still wanted to go into medicine.
And what did Dr. Delp think of Dr. Major?
Well, as far as I'm personally concerned, he was the physician of all physicians. He was the teacher of all teachers. He was the outstanding man in the medical school from its beginning up to date.
Late in his career, Dr. Delp was offered the position of Chair of Medicine, a position he had been passed over for years earlier.
I think I might have been just a little bit irritated about it, but nevertheless, I submerged that and I was very happy to take it. Maybe one reason I was happy to take it was because it was something that Dr. Major wanted, so that was pleasing to him. And that made it much more palatable to me.
Dr. Delp clearly regarded Dr. Major as his mentor. He tied a considerable amount of his own life's work to continuing Dr. Major's life's work. Dr. Major first published his book on physical diagnosis in 1937. As it went through multiple printings, Dr. Delp began to collaborate with Dr. Major on the updates. And after Dr. Major died, Dr. Delp changed the name to Major's Physical Diagnosis and continued to update it through its 9th edition in 1981. More telling than this is Dr. Jared Grantham's remembrance of Dr. Delp's care of Dr. Major during his last 7 months as an inpatient at KUMC. Dr. Major had suffered a stroke that was nearly totally debilitating, and Dr. Delp never sent him to a managed care facility, instead keeping him on his service the entire time. Dr. Grantham writes, "Rumors floated among some faculty that this was Dr. Delp's way of getting back at the man whom he had served with all of his heart and soul, without adequate affirmation. I could not imagine such a motive in Dr. Delp, but had no evidence for this view until I reviewed Dr. Major's medical record. For those 7 months, Dr. Delp made daily progress notes in Dr. Major's chart, seizing on glimmers of potential restoration of neural function. Page after page of these notes are inscribed there, each initialed or signed by Mahlon Delp, MD. Dr. Major meant so much to Dr. Delp that he could not let him go. Dr. Major died peacefully at KUMC on October 15, 1970.